Hello, my name is Iago Lopez. I'm a family practitioner from a private clinic called Centro Pontevedra, and today we are going to make our first English-speaking video of our channel, given that lately we have been drawing some attention from some English-speaking countries like the USA and the UK. So in this first video we're going to address the translation of what has been our most popular video so far, which is headaches, how to manage them and how to identify which symptoms may be cause for alarm or cause for going to the ER. Deciding whether you must go to the emergency room or stay at home is a very important decision, because in many countries the medical assistance is far from affordable. So you risk spending a lot of money for nothing, and even in those countries with the health system is free, you are risking losing a whole afternoon in the waiting room of the medical clinic, of the emergency room. So in this video I will try to ease your decision in this matter. Also, in order to make this video more functional, you will see some shortcuts in the comment section, so you can skip through the video to the exact moment where you want to find the information you're looking for. But if you do want to understand what happens during a headache, I strongly recommend that you watch for most of the video. So let's get into the matter. Headaches are one of the most common chief complaints we found both at the doctor's office and the emergency room, and there are multiple reasons for this. Medical encounters may be caused either by pain of high intensity, which obviously demands relief, but in most cases it's also caused by the fear that the symptoms, that my headache may be a sign of alarm of a real hazard of any impending disease, like a brain tumor, a stroke, or even a vessel that is about to burst. And this, in fact, may be the case, but fortunately, in most cases, it is not. And it's very reasonable that patients feel doubts when it comes even to decide if this is a cause important enough to go to the doctor or not. But before we begin speaking about the symptoms, there is an important thing to clarify, and that will probably make you feel less anxious about your pain. And this is that the brain can't feel itself, and thus it can feel its own damage. It can feel somehow surprising, but the fact that you are able to feel your limbs, the fact you are able to feel your hand, your feet, is due to specific nerves that carry information about each region, and a very specific information. You have nerves that carry information about temperature. For example, they make you able to feel warm or to feel coolness. They make you able to feel vibration. They make you able to feel the tactile sensations, and of course they are able to make you feel pain. But the brain doesn't have the nerves to itself to perceive that kind of sensations. So nobody feels coolness in the brain, nobody feels vibration in the brain, and nobody feels pain in the brain. But there are another structures in the head that may feel pain. For example, some vessels, arteria, for example, are very sensitive to pain. Also, the bones of the skull are sensitive to the pain, and meninges are very sensitive to pain, especially dura mater, which is in many cases the cause of pain for some reasons that we will talk about later. And we shouldn't forget the scalp, the skin that covers our calvaria, which is also very able to feel pain, and in most cases it causes confusion because people feel pain in their scalp and they think it's something about the brain, and by definition the scalp is outside the encephalus, it's extracranial, so it doesn't have anything to do with the brain. And even saying that, maybe you have sometimes seen a movie or a TV series about neurosurgery. You will probably have been shocked by seeing some scenes where the doctor is making an intervention in an awake patient, and he's stimulating with an electrode different parts of the brain to make the mapping of the tumor that he's going to extract. And he stimulates, for example, the parietal area, and the patient may feel sensation in the limb. When the doctor stimulates the back of the brain, the occipital area, the patient may feel some visual sensations, but no patient feels, oh doctor, you are damaging my brain, because they don't have that ability to feel that. So as we have said, the brain can feel itself, but there are some brain diseases that can cause pain from an indirect way, and is by stimulating pain in those areas that we have mentioned before, in the skull, in the scalp, in the meningitis mostly, and that is the reason why some people who suffer from brain damage, they can feel pain, but it's not the main symptom never. This clear, we're going to explain the two main types of headaches, which are not the only ones, but they are the vast majority of the overall number of headaches that go to the emergency room of the medical office, which are the migrainous headaches and the tensional headaches. Most of the headaches classify into one of those types, and knowing which one of these headaches you have is very, very important in finding out which is the cause of your headache, and it's a classification that also doctors use in our clinic. So we're going to begin with the migrainous headache. The migrainous headache is usually one-sided. Usually the patient feels the pain clearly on the left side or on the right side. In some rare cases they can feel in the rear of the head, but it's not the most common manifestation. Usually it's one-sided. And usually it's like a pumping pain. Most people with migraine think that they feel their heart pumping into their head, because they feel like hammerings in the head. Pum, pum, pum. It's very, very typical in opposition to the other type of headache. Also, the patients suffering from migraine usually present photophobia and phonophobia, which means that they usually run away from lights and from noises. They really hate noises during the pain, and usually they go to the room which they are with no lights and with no noise to reduce the sensation of pain. And it's also a very common symptom that people with migrainous headaches usually have some nausea or even vomiting, which also makes it further difficult to treat them with oral drugs, because many people may drug the pain, may throw up the painkiller before it reaches the blood. So it makes more difficult to treat this kind of pain. The cause of migrainous headaches is of course migraine, hence the name. But there are also some other causes of migrainous headache that usually refer to vascular diseases like arteriovenous malformations, like aneurysms, can also make this kind of pain. But we'll leave it to a later discussion. Now we are going to focus in the second type of headache, which is the tensional headaches. Usually the tensional headaches is as opposite from the migrainous headaches. It usually is either center or symmetrical. The patient can decide which side of the head suffers the most. Also, the intensity of the pain is quite constant. There is not that pumping sensation that people with migraine have. It's a constant kind of pain, whether it is intense or not, but it's quite stable. And also, there is no photophobia or phonophobia. Of course, people with any kind of headache don't enjoy noises or very loud voices. But people with tensional headaches, we would say that they don't run away from noises like people like me, like migraines. And usually, the people with tensional headaches, usually they don't feel nausea, they don't throw up, unless if it is a very intense headache. But if it is not very intense, the people usually don't feel any kind of nausea or any kind of intention of throwing up. And it is also a good way to differentiate one of another. So these are the two main types of headaches. These are the two types that books refer to, and that was I was taught when I was a student. Real life is, of course, much more complicated, and people usually don't have perfect headaches. Every doctor along his career has come across many patients with mixed characteristics that make the diagnosis more difficult. But in most cases, the patient clearly can relate to one of the types without confusion. And this is what guides me to the final diagnosis of the cause of the headache of my patient. So, after this explanation and knowing the two basic types of pain, we're going to address the first one, the migrainous headaches. If you have a headache that resembles a migraine, of course, the most probably cause is a migraine, but there are another very important diseases that can resemble this. So it's very important, it's critical to difference a real migraine from what we will call a false migraine, which usually is a vascular disease. So migraines usually comply to three features that we can identify. The first one is recurrence. People who suffer from migraines usually suffer from many migraines through their life. So it's usually that a patient who comes with a migraine is not their first one. So recurrency is a very indicative factor, a very indicative feature of that real migraine, and not a vasculitis, not an aneurysm, etc. The second feature is that they usually have an inheritance pattern. It's very usual that a patient who suffers from migraine also has some other relatives that also suffer from migraine. So having more relatives that suffer from migraine and have been correctly diagnosed is another feature that can be taken into account. And the third one is that usually the onset of these recurrent headaches is usually in the second decade of life. People who begin suffering from migraines, they usually are teenagers or young adults, and migraines happen from now on. When a patient complies to these three features, it's a quite sure diagnosis. But I personally, in my office, I prefer to find even further assurance by trying a specific treatment. There is a family of oral drugs whose name usually ends with triptan that only work for migraines. Thus, if a patient perceives a clear relief after that kind of drug, I feel very sure that my patient only suffers from migraine and no other kind of pain, which of course any kind of assurance in this matter is always welcomed. So if you have a migrainous headache and complies to the three characteristics, or even the fourth one that should be prescribed by a doctor, we are talking about a very painful but mostly inoffensive disease, so you can rest relatively sure. But if you're suffering right now from a migrainous headache that doesn't match to those features, my advice is that you go to the doctors or even the emergency room, because there are very important diseases that should be diagnosed and treated as soon as possible. So if you don't comply to this, please go to the doctor. Tensional headaches are usually caused by contractions in the muscles of usually the muscles of the neck, the back of the neck. The muscles of the nape usually are a common cause of tensional headaches, but also some very important diseases like brain tumors, like an elevation of the intracranial pressure can also make this kind of pain. So it's very important to clarify the diagnosis when we are talking about a tensional headache. Usually the normal one, the tensional headache caused by the tension in the muscles, usually is not very grateful to the painkillers, so to say, but usually responds quite well to when we apply local heat in the nape for 10 minutes, and that is followed by some stretches of those muscles. Usually the intensity of the pain quickly lowers, and it helps to diagnose that we are talking about a muscular disease and not a brain disease. So if it goes well with heat and stretches, of course it's a good sign. You have a diagnosis and you have a treatment. So it's also important to evaluate the blood pressure level, because when it's too low, it's usually inoffensive, but when the blood pressure is too high, it can cause this kind of thing, or for many reasons that we explain later, it's very, very dangerous. If you have a blood pressure level which is above 200 millimeters of mercury in the systolic tension, or 120 in the diastolic pressure, you must go to the ER immediately, because you are in real danger. Another thing that we have to take into account is that during a tensional headache is that cough symptoms are present at the same time as the tensional headache, especially if there is nasal obstruction or nasal congestion. It is very probable that we are talking about a sinus pain. The most probable cause would be a sinusitis. And this can be treated with conventional home treatment, but you should seek medical assistance if you present fever, especially if the fever reaches above 100 Fahrenheit or 38 Celsius, because it is very suggestive that it will be a bacterial infection that should be treated with antibiotic treatment. So if fever, elevated fever is present, go to the doctor. There's another thing that we should take into account. If the pain is unbearable, I think that we should go to the ER also, because when it's really unbearable, there are two reasons to go to the doctor. One is that kind of pain demands relief. The second is that high intensity pains can of course be related to very important diseases. So it is not a loss of time to go to the doctor in that occasion. I think that these clues about the two main headache types will make you able to identify with some accuracy the cause of your pain, and thus help you to decide whether you should go to the doctor, or you can wait for tomorrow, or you can stay at home. And it's very important, and it's very, very similar to the criteria that the family practitioners use in our office, because most family practitioners work away from a hospital and don't have access to many medical tests, but also to any doctor who works with some ethics, because when we do a lot of medical tests to a patient, we are making the medical assistance much more expensive, and furthermore we are making the medical assistance more dangerous, because we should not forget that when we ask for a CT scan, for example, we are submitting our patient to a lot of radiation, which risk this patient in the future for more exposure to the risk of developing a cancer or any radiation-related disease. So it is very important that the doctor is quite picky when doing the interview to the patient. So we collect all the data and to see if we can avoid the most medical tests possible, because they are expensive and they are not always inoffensive. So it's very important to collect all the information we can before doing any other kind of test. We are going to talk specifically about three diseases that scare patients the most, at least in my experience. There are three diseases that scare people very much. Well, they have reasons to be scared, of course, but they are the main fears of patients, which are brain tumors, strokes, and meningitis. So we are going to talk about the usual behavior of these three diseases to make you further confident about your headache. So we are going to begin talking about how a brain tumor usually behaves. When we are talking about a malignant tumor, the pain is usually present at the final stage of the symptoms, because usually it presents much more symptoms of brain damage before the headache is present. So virtually everybody notices these symptoms before any kind of pain. For example, it's very typical that malignant brain tumors present themselves as seizures in an adult, palsy of some part of the body, blindness, which particularly one type of blindness which affects the peripheral area of the visual field, that are very typical symptoms of a brain tumor. And if a malignant tumor gets really big, or even a benign one gets really big, then we will begin to find headache, and that headache will be caused by what we call intracranial high pressure, and it's very easy to understand. As our skull is a rigid cover, at the same time that a tumor begins to grow, it causes the pressure inside the brain to elevate. And when we have a very high pressure inside the skull, the only way that our blood vessels can irrigate blood into our brain is pumping at a very high pressure. So it is impossible to have a very high pressure in your brain and having a normal blood pressure, because you wouldn't be alive. If there is a high pressure, the blood must enter at a higher pressure than the pressure that is in the brain. And also, this kind of high brain pressure usually comes up with a lot of vomiting, very, very intensive vomiting. So if you are fearing that you have a brain tumor, but you don't have any signs of brain damage, your blood pressure is normal, and you are not throwing up, I think you can be quite calm about that kind of fear. Now we are going to talk about the second one, the second cause of fear, which is strokes. As the things that I say to the brain tumor also applies in great shape to the strokes. The strokes mainly cause brain damage, and if it is a very extensive brain damage, is an hemorrhagic stroke which makes the burst of a blood vessel, they can cause a headache. But before the headache, usually the patient has a lot of symptoms of brain damage, which can be identical to those that I said before. So if you have an intensive headache, and your blood pressure level is normal, and you don't have any kind of brain damage, again, as I said in the brain tumors, it's not very probably that you suffer from a stroke, because if you suffer from a stroke, if it is either a very extensive one, ischemic, or a little hemorrhagic stroke, you will have a very high blood pressure level. And that is the reason why I said before, when I was talking about the tensional headache, that it was very important to evaluate the blood pressure of the patient. And if the blood pressure is very high, of course the patient must run to the emergency room, because one of these things can be happening. But if the blood pressure is normal, it is very difficult to having a very extensive brain damage. And now we are talking about the third feared one, which is meningitis. The meningitis in the very early stage can confuse any experienced doctor, because the symptoms can be very mild. But in a few hours, meningitis begin to expose many symptoms that are nearly, I think, that are very difficult to be confused about, because they cause a lot of neck stiffness. They usually cause fever, a lot of vomiting, and temporary mental disorders like changes in personality. So usually there is quite easy to identify. So if you have a headache but you don't have fever, you don't have neck stiffness, and I am talking about real stiffness, not as a mild stiffness, a very clear stiffness, and you don't see anything strange happening about your mind, is the probability that this is a meningitis is very low, and also you can re-elevate your state some minutes later to see if anything has changed. But if you don't think that you relate to the symptoms, I think you can be quite calm about it also. And I think that for today what has been said is more than enough. I hope that you have found this video useful, and I really hope that at least has been somehow understandable, because I suppose that any English speaking person will find my choppy English quite difficult to follow sometimes, but I hope it hasn't been very annoying. If you like this video or not, any kind of feedback will be appreciated. If people respond positively, we'll begin translating some other videos which has been successful so far, like tricks to treat the migraine properly and how to manage chest pain, for example. If so, we will create a separate channel for English videos, but for now, if you want to subscribe, you will find the icon for subscribing right here, and we also have a video about high blood pressure and how to interpret it that you will find in the box at this point. But until next time, I think it is more than enough, so goodbye.